Yeah. I think we can start. Sharp 8 o'clock. So I will start with the short introduction and then we can go.
Welcome, Don.
Morning.
Morning.
Yeah, good evening.
Yeah, good evening, your morning.
Yeah, let's see. Where's my
So here to book. Very good evening, dear friend. Today we having a one more webinar in this series of the our AACCI International Forum webinar series with our eminent two speaker who having a really masters in their field. I just introduce them and the about the today's topic, let's introduce shortly about the AACCI. We all know very well that AACCI is established in 2008 with a main aim and objective to involve the urban-based activity with their pillar that included teacher, parents, and their children and youth. And now we also added the our one more pillar that is grandparents. We have a unique 11 centers and 4 forums with or more than 250 volunteers working across the country of the India. And now we also having our own volunteer and our own friends who are in the outside the India also working hard to give a more active involvement in the AACCI. And this is the one more activity that is what we had planned to do our international by international forum. And for the formal intro welcome, I invite our Executive Director, Dr. Swati Bhave ma'am, to do the formal welcome and then we can start our presentation.
On behalf of AACCI, I welcome Neil, Soares, and Julie, today's speakers. After a wonderful session from Neil last time, we had excellent feedback, and we are very happy that Neil is giving a second session, and he has added Julie, the expert in the field. So together, I'm sure they'll do a great job. I also welcome our chairperson, Dr. Grade Annis from USA. And now I think we should start.
Right, ma'am. So today, myself, Dr. Samir Sir, the national coordinator of the AACCI, along with the Dr. Sandeep Kavre, the our for Pune in charge, we combinedly do the MOC of this program. And I just happy to introduce our today's two speakers. Our first main speaker who has really go for excellent presentation in last month, and today again he is with us, that is Dr. Neelkamal. He is the professor of the biomedical informatics at the Western Michigan University, Homesteker, MD School of the Medicine in Kalamazoo and Michigan, USA. He is adjunct professor of the pediatrics at University of the Michigan Medical School in Ann Arbor, Michigan. He is board certified in developmental behavioral pediatrics and earned his MBBS at University of the Mumbai Lokmanya Tilak Municipal Medical College, then completed his residency at University of the Illinois at Chicago in pediatrics, followed by the fellowship in the development and behavioral pediatrics at University of the Maryland, Baltimore. Our second co-speaker is the Julie Jain. She is a board certified pediatrics and is a third-year fellow in development and behavioral pediatrics at University of the Michigan in Ann Arbor, Michigan. She completed her medical school at Michigan State University College of the Osteopathic Medicine, a Masters of Public Health at Michigan State University College of Human Medicine, pediatric residency at Assistant St. John Children's Hospital and is in her final year of fellowship in developmental pediatrics at University of Michigan. She has research interest in the early childhood relation, health, media use, and feeding practice, and clinical interest in improving the patient and clinician education around the learning disability. With this short introduction about the today's speaker, I just hand over the mic to both the eminent speaker to start their presentation on screen media and youth. We have divided this topic in two presentation, and today our main age targeted group are the infant, toddler, and preschooler. So now stage is yours, sir.
Thank you so much, Dr. Samir, and thank you for the kind words, Dr. Bhave. It is my honor to have Dr. Zaituna with us, and I will start the first few slides, given Indian context, turn it over to her, and then jump back in with some of the IAP guidelines. So just as clarification, we have no conflicts of interest related to this presentation and no financial disclosures. Some of our objectives for today is we'll discuss, how infant, toddler, and preschool age development intersects with digital media environment by highlighting each individually and then together, and talk about some of the evidence for media use and guidance, both in a US context, but also in an Indian context around media use for infants, toddlers, and preschoolers. As Dr. Samir had said, we've got a whole different presentation for school-age kids and adolescents, which we will discuss later in this series. So starting with an Indian context, so, particularly since COVID and even before then, there's been a huge boom in the digital space, and there's almost near universal smartphone devices. In fact, recent studies show 96% of toddlers have access to a smartphone or a handheld device, as compared to 86% for traditional media, as we would, say as TV screens or desktop computers. And Indian toddlers, in a study that was done in Delhi, shows that, screen media exposure starts as young as 2 months of age, and it is near universal. In fact, 90% of those less than 18 months are viewing the screen for more than an hour a day. And many of the parents in this study were not concerned about this. So this is a study specifically around, 15 to 18-month-olds. But so the parents in that study were not concerned. The other study that was done was more rural in its nature, and this was in Gujarat. And they found that in 2 to 6-year-olds, so slightly older than the first study, the average screen time was almost 2.5 hours a day. And the more that the parents are using media, and the more that there are multiple devices in the home, increase the odds of increased screen media use. And weekends showed a lot more than weekdays. Again, remember, these are up to 6 years of age, not really the school age or older kids. And so the reason I bring this up is it's a huge problem. And parents really, and we'll talk later about how now they're getting more concerned. But as recently as 2019 and 2020, there wasn't as much concern about this use. So these are all pre-COVID studies to begin with. The other thing is, of course, there was a study done in Tamil Nadu, again with young children, which is the focus of our talk today, that said similarly about mean screen time was about 2.5 hours a day. But now we come to the impact. And screen time, increased screen time was associated with, again, parent screen time, bedtime usage, and then, when kids were attending school, particularly daycares or preschool, there was actually more, which is interesting because one would ask the question, is this related to mandatory work that they're being assigned to work on the computer, etc.? And increased screen time was associated with developmental delay, particularly in language acquisition and communication. So it's important to know this context because, as Julie is going to talk about a bit, this is pretty similar to the things we see in the United States, quite a bit of screen media use and impact on development. now that I've sort of set the stage for like the problem and the problem starting from India, let's pivot to some of the issues that we see in the United States, which are similar. So I'm going to advance slides and Dr. Zaituna is going to take over.
Thank you, Dr. Soares, and thank you to AACCI again for the opportunity to present today. And so in shifting over to thinking about the landscape of digital media use in the US, this table indicates time spent on media by activity in children from 2011 to 2020. Again, this is based upon data collected by Common Sense Media. You can see here that the time spent on TV overall has remained about the same, but that children are engaging with online and subscription videos, for example, like Netflix, Hulu, that this has increased exponentially. Next slide, please. So the significance of this is that children are spending more and more time on digital devices. The pandemic has underscored that it is a clear part of children's lives and not just a covariate, but a substantial contributor. You can see in this graph that children under 2 are exposed to about an hour per day of digital media. Children 2 to 4 years are exposed to about 2.5 hours, and children 5 to 8 are exposed to up to 3 hours. These data were collected before lockdowns in winter, spring of 2020, and so they likely reflect an underestimate of what actually transpired to happen during the further in the pandemic when lockdowns occurred. And it's not just about the time or duration of media use, but the content and the context in which the media is used. Next slide, please. And so in thinking about the shifting uses of digital media, we can think that the overall duration of TV and video viewing comprises a large share of the digital media landscape for young children. However, we can see that online videos and subscription services are comprising the large majority of this. With these graphs here too, I would expect that the overall share of TV and DVD usage has continued to decline, with online and subscription content continuing to increase since this collection of data in 2020. Next slide, please. And so in thinking about access to the internet in the home, this has been stuck at about the same level since 2017, with more than a quarter, about 26% of lower income families in the US lacking internet access. More than a third of children from lower income households do not have a computer in the home. As the pandemic illustrated, access to remote learning became essential. The graphs on the right-hand side of the slide are illustrating additional digital divides based upon demographics in the US, with increased screen media use reported in lower income and historically minoritized groups compared to higher income whites. Next slide, please. You can see there's a substantially higher quantity of digital media use among Black and Hispanic and Latino individuals in the US, likely resulting from systemic divestments in infrastructure and resources which have limited developmental opportunities for children, such as access to safe play on playgrounds or in neighborhoods, extracurricular activities, and decreased flexibility around parental work schedule and the provision of childcare. We can also see differences by education and income level. Next slide, please. And so in thinking about an organizational structure around development and media's impact on development, it's helpful to think about it in an ecological systems framework. First, we can think about content. What is being watched? Is the content educational? Is it violent? Is there sexualized content? Is there consumerist content? Next, we can think about context. Who is watching? Are there other stressors that are happening at home? What are the characteristics of the child, considering developmental level, temperament, as some of the characteristics? Finally, we can think about displacement. What are the missed opportunities for other activities of daily life for the child, such as learning, sleep, and play, that could be occurring instead of media usage? Next slide, please. And so we will switch over to thinking about infants, development, and digital media, with having this context to view this topic. And so with the key aspects of infant development, we can think about how interactions typically occur with infants. We know that optimal development is contingent upon early relational health with the infant caregiver dyad. Language development typically occurs by the caregiver talking with the infant, responding to the infant's early vocalizations and facial expressions. So responding to those clues, responding to smiles. And this reinforces turn-taking in communication and social reciprocity. We can also consider typical development of visual acuity and mobility through the lens of Piaget's cognitive developmental theory and the sensory motor exploration that infants use to explore objects and their environment. We know that it is critical for cognitive development for infants to compare and contrast the properties of different objects in real time. For example, does this toy make a crinkly sound or a rattling sound? Is this ball hard or soft? That these are all really critical developments for typical brain development during infancy. Next slide, please. And in applying the ecological framework to digital media use in infants, we can think about what the media use is displacing, the context of the infant who is consuming it, and what content is being viewed by the infant. Next slide, please. We know that in general, infants in the US are exposed to about 1 to 2 hours of digital media per day, in contrast to the recommendation from the American Academy of Pediatrics that discourages the use of screen media other than video chatting in children younger than 18 months. This recommendation was centered around the role of increasing media in displacing the natural opportunities that infants spend exploring, playing, and spending time with their caregivers, which are all crucial opportunities for supporting optimal development. Next slide. We know that in considering the context of media use, that infants with greater duration of screen media exposure have had lower developmental scores in language in the toddler years and lower scores overall on a developmental screener, so considering the ages and questionnaire, and more infant social emotional problems reported. Next slide. We can also think of the context of the infant's parents and parental use of mobile devices, which can be disruptive to parent-child activities, including play. Parents have been found to have decreased responsivity to infant cues when they themselves are engaged with a screen device. Parents also reported perceiving themselves as less responsive to infants as they were more disrupted by technology use themselves. However, in considering co-viewing of screen media with a parent, it may help the infant understand and learn from the content being viewed. Parental co-viewing may also help buffer associations between greater quantity of television exposure and less optimal infant language development, as studied among low-income families in an urban setting in the US. Next slide. In terms of the content being viewed by infants, this is less important than the context and displacement that were previously discussed, as infants are not able to transfer two-dimensional information from a screen to the three-dimensional world. Instead, infants learn best from their caregivers directly, compared to identical content being delivered across a screen. This is referred to as the video deficit effect, which can persist through the early preschool years as well. Next slide. In thinking about infants and the serve and return nature of interactions with caregivers and their environment that is intrinsic to supporting optimal development, the bottom line is that parents are the best matches for supporting their infant's developmental needs and are a better learning tool for their infant than a screen. Next slide. And so what can we do about this? How can we counsel families about media use with infants? We know that for fussy infants, there is a greater risk for using screen activities to soothe the infant. So recognizing this and having an open and supportive discussion with parents can be helpful. Similarly, discussing the importance of families engaging in screen-free activities throughout the day, with the parent modeling this screen-free time. Having a discussion with parents about the mindfulness of using their devices when they are with their infant can also be helpful. For example, is the parent actively responding to something that cannot wait, like an urgent text message, and that they can then separate themselves from their device? Or is this something that could be delayed, such as scrolling through an Instagram feed? If screens are being used, talking about this mindfulness can be helpful. And so we will switch now, if you could advance slide, Dr. Soares, sorry, to considering toddlers, preschoolers, and their developmental and digital media use. And so in thinking about toddler development, We know that neuroplasticity is rapidly underway as their young brains are rapidly connecting synapses to strengthen certain connections, while pruning is also actively occurring, further refining neural pathways. Toddlers are rapidly engaging in the processing of rich sensory information, which is informing these synaptic processes. Language and social and emotional abilities during this age map onto future adult abilities. Toddlers are increasingly seeking independence and autonomy and will try skills over and over until they master a skill, which also influences how their neural pathways are being wired together. And so we'll again apply this ecological framework, thinking about displacement, context, and content in thinking about typical toddler and preschool development. And so in thinking through displacement for toddlers, the American Academy of Pediatrics recommends limiting screen media use to less than 1 hour per day in this age group. This is allowing for time to engage in those other developmentally enriching activities, such as unstructured play, physical activity, reading with parents. However, most children are spending an average of 2 to 3 hours per day with screen media and 2 hours per day on a tablet device alone. So this is a shift that's being reflected, as we've discussed previously, that prior to about 2017, 2018, that typically this was mostly happening with TV viewing. However, the landscape is rapidly shifting so that toddlers and preschoolers are being exposed to more online and subscription content, which can have less stringent regulations that had previously been placed on television. And so as duration of screen media use has increased, it's also associated longitudinally with lower overall developmental scores on the Ages and Stages questionnaire among preschoolers. Older age at first screen exposure is associated with stronger language skills. And so delaying that exposure has been shown to support language development. And in thinking about context, in thinking of the context of the toddler is able to learn to transfer information from a 2D screen to daily life when co-viewed and supported with a parent. The more involved a parent can be in this co-viewing process, the more the toddler can recall concepts. With one study in toddlers finding that participants were best able to recall concepts from an infant DVD when parents provided substantial teaching commentary while they were co-viewing with toddlers. And so having this supportive, almost mentoring relationship while viewing any digital content has been found to support the best learning attributes for a toddler and preschoolers. And so in thinking about context or in content, it is much more important for toddlers than it had been previously for infants. And so exposure to high quality content such as Sesame Street, Daniel Tiger's Neighborhood, Blue's Clues, Dora the Explorer, some of the common television programming in the US has been associated with improved language literacy and social emotional competence and pre-academic skills. However, as we touched on, the proliferation of YouTube and streaming video websites that many children are not having access to this high quality educational content, as algorithms may be sending them other content that does not have this educational content. I will say from my own preliminary research that's investigating YouTube content in children ages 0 to 8 years, that a lot of programming on YouTube that is advertised in the thumbnail or in the actual heading for the video is being billed as educational for children. And if you actually view the content, is completely devoid of any educational content. One example that comes to mind, if anybody has encountered it, is Blippi, that has a lot of branded food content and just consumerist tendencies that really does not have any educational value, despite being billed as such. Next slide, please. And so in thinking about app content, there are very few commercially available apps in the educational section of app stores that are actually educational. Recent review of hundreds of toddler and preschooler apps labeled as educational demonstrated that most apps show low educational potential and really are only targeting rote academic skills such as ABCs, colors, shapes. So really being able to regurgitate this rote information versus having that serve and return type of nature where the toddler and preschooler is interacting with the caregiver about learning such skills. There's almost no input in these apps development that's coming from developmental specialists or educators. Conversely, next please. Some content does actually have backing and developmentally informed approaches. So Sesame Workshop is one such resource that has a team of psychologists that are helping to develop the content without any advertisements, and that there's no tracking on the device. So this is actually a really wonderful resource that if anybody has not encountered it, that Sesame Workshop has multiple different subsections with developmentally appropriate content for families and for children on tough topics, in addition to medical topics. So there's tough topics that they cover with digital content, including videos, workable storybooks that are online, coloring sheets that can be printed out and downloaded, as well as parent articles that can be read on incarceration, divorce, addiction, traumatic experiences in children, and then also on health conditions such as autism, asthma, and behavioral regulation techniques. Work from Meyer and Radesky found 135 apps for kids ages 5 and less, and found that there were many inappropriate ads and content, such as mental health resource advertising that was geared towards adults that was put through on the app, as well as coercive strategies for in-app purchases. And so this picture here is highlighting an in-app purchase on a strawberry shortcake app that could be made. And so as you can see, it's pretty subtle, but that was something that had been found that children are able to engage with. Next slide, please. And so there is promise for digital media with some well-designed apps such as the Sesame Workshop material that we had discussed being found to be helpful for improving specific skills. However, having these tightly designed study apps, having specific learning goals that are identified, and having adult help to work through that educational content is critical. And so just in sharing some practical tips, children younger than 18 months should have media use discouraged other than video chatting for the American Academy of Pediatrics guidelines. There should be time for unplugged spaces and times, such as dinner time, bedrooms, and this is really important for both the child and the parent to have this unplugged time. These times are important opportunities to catch up with family members and to share about the day. And also we know that because screens emit blue light, that this can stimulate the production of melatonin. And so it's influenced it's best to avoid screens an hour before bedtime and to instead fill this time with shared reading, singing songs, and getting ready for bed to wind down. Next slide, please. And so using media in social and creative ways that's not displacing sleep, exercise, play, or in-person social opportunities. And so that's the importance of this co-viewing. So video chatting, which obviously can bring families together, having age-appropriate shows and games that can be interacted together with the parent readily engaging with the toddler. And then as the child ages, thinking about video games as being a way to help teach sportsmanship. And again, having this really close relationship with the parent interacting with the child. And so some helpful resources that can be used to give to families include commonsensemedia.org and pbskids.org. And then in summarizing, younger children don't have the ability to learn yet from digital media, especially when thinking about that infant age group. With toddlers, it really is critical to have that co-viewing piece of things so that they're viewing with their parent to learn and have that back and forth conversation that's really so critical for them to be able to engage with those skills. And so really for children younger than 18 months, there should be discouraged use of screen media use other than video chatting. For children 18 to 24 months, choosing high quality programming and viewing together. and avoiding the use of technology reactively to help a child calm down or regulate. Children need to be able to identify and handle strong emotions, and having tech used as a go-to strategy for calming emotions is just not practical or effective to building those skills that will be used throughout the developmental course. Next slide, please. For parents, reflecting on what are enjoyable ways of using digital media, being mindful about how parents themselves are using digital media and drawing boundaries with the usage. So creating those separate spaces of meal times and bedtimes where there really is no media use, if it's at all possible. And then lastly, it's not just on parents, but up to digital media companies to create spaces that are family friendly and meet the needs of children. And so just to underscore with YouTube particularly that there really is no specific way to turn off the algorithm. And so even with YouTube Kids, that there can be content that can slip through that has these consumerist or otherwise inappropriate content that can happen. And so one way that parents can deal with this is creating their own YouTube playlist with videos that they themselves have viewed and ensured that have appropriate content, and then having the child be directed to use that specific playlist instead of being continually engaging with that algorithm where it's sending videos to the child. Next slide, please. And then as pediatricians, just being very open and curious about the relationship that parents have in using digital media with their children, having open-ended questions that are not necessarily blaming the parents, but shifting that blame towards the digital media companies and the lack of regulation that really is happening with them. And just having them be very mindful of ways that they can empower themselves to be able to use this digital media with their children successfully. And then motivational interviewing techniques can be helpful with inquiring about the devices with questions such as, where do you keep the TV or mobile devices in the home? And then asking follow-up questions such as, how does that work for you? For example, if there's a television that's in the bedroom, or if the child has access to a device while in the car, just kind of asking those open-ended questions with that curious lens to get more information. And then empathizing with parents that clearly sometimes there's a time and a place for everything, and acknowledging that can happen with media use, and then just trying to build upon best strategies and giving evidence about why it's possible to inform these decisions going forward. And so really just highlighting that parents are the best toys, even with all the rising availability of digital content and digital toys. And really, we'd like to learn more about the ways that media can function to support or hinder how parents can interact with their children.
Thank you so much, Julie. I wanted to sort of, circle back to what the IAP has to say about this. So in 2022, the IAP published in Indian Pediatrics guidelines for families around this. And they sort of mirror a little bit of what, the US and the AAP has had to say, that, really limit or absolutely avoid any type of screen. The one thing I'll say is I like what the AAP said is they exempt video chatting. And this is such an important thing. And I know AACCI is planning on having sessions in the summer or later around how grandparents in India stay in touch with family members. That would not be possible without video chatting, and the pandemic has showed us it's a powerful way to remain connected socially. So, whenever somebody says don't include any screen time, as a caveat go, but video chatting with family members or maybe other cousins or children would be appropriate. And then from 2 to about 5 years of age, maximum of 1 hour, again, supervised screen time, co-engage, trying to narrate. So it's really, pretty similar to the policies and the recommendations in the US. Same thing that Julie talked about, the IEP talks about, there should not be displacement. So time spent on screens should not replace, physical activity, sleep, other types of academic and skill building. And since the research, as I had shown you earlier, really shows that multiple screens in the home is a risk factor for increased screen media, really try and, make it only about one screen at a time with the family co-viewing. Supervision is important, again, because even if you think that it's educational, it's probably not, unless it's very well curated. It's probably got, a lot of hidden agendas in terms of advertising, in terms of redirection, etc. And interactive is better than just, one-way direction. So sort of things that require the child to enhance their skills, fine motor, language skills, working with the parent. It should not be used, as Julie pointed out, before sleep. And they included surface travel, which is very interesting. I assume then they're saying it's okay to do it on a plane, right? Because on long distance, etc., you've got these individual seat backs, which again but again, I would suggest that the parent reach over and consider the seat back screen on a plane, similar to doing it at home, right? Limit the time, make sure it's interactive and not just, just because the child can touch their own screen doesn't mean anything is okay. Because the many times, and I've seen this, the airlines take no responsibility for the type of programming there. So there'll be a warning, and it's up to the person sitting in the seat to avoid that. But there's nothing to prevent, based on the age of the person sitting in a seat, that they will not give that type of content. The other things that the IEP talks about is that please don't use screen media in the office, either during examinations or procedures. And, this is important because it's possible that some practices have tablets where you go, this will help a child. But again, we're feeding into that, pattern of behavior, because modeling is so important, right? If parents are expected to model, then if a trusted professional like a pediatrician or a healthcare provider is not also modeling, then what's the message the child is getting? Apart from, as Julie pointed out, discussing with families, it's really good to have materials in your office about the dangers of excessive screen media, about healthy ways to do it. And so, having flyers and handouts and little QR codes, etc., would be really good for this. Really good to display information, not necessarily on screen. So again, what are other things to do? Written materials written at a child's level, or depending on literacy. In India, it's really important to have it in multiple languages. And again, shifting the blame, not being judgmental, acknowledging that parenting is very hard. It's challenging. There's not enough time in the day to get all the things done. But screen media should not be the babysitter that you otherwise can't afford or you can't find, and should not be the way to soothe your child because you're too busy doing something else. So sort of working with families to build their own skills, to make sure they understand the value of engagement and the downsides, particularly of child development for young children and screen time. And don't just make it about the physician and the families. Really educate other people in the community. Who are the community leaders? Who are the community health workers who in some areas go and visit families, right? They're talking about immunizations. They're talking about healthy habits. But are community health workers also talking about screen media? Are they taking inventory of that? That would be amazing, because the one thing we lack in the US is that amazing community health approach, right? So we rely on what families have to say when they come in, and families have gotten savvy over the years. They know that, just like smoking and, other types of things are frowned upon by certain healthcare providers, they may not be willing to disclose the amount of screen media use they're using. But trusted community health workers who go into their community, who are part of the community, maybe we should think about, do they have a sort of a certain script to use to have this discussion? So for people who want to read more, and I will be delving back into the IEP guidelines when we talk later in the series about the older children and adolescents, because they've got a lot of recommendations for those as well. But if you wanted to read it, it's from Indian Pediatrics from 2022, Gupta et al. I do know that one of my colleagues in developmental peds, Samir Dalwai, has been one of the co-authors of those guidelines. There are many references, and I would be happy if Dr. Samir and others shared this. This is all thanks to Dr. Zaituna putting together, many of the things that we talked about. Remember, she had talked about Common Sense Media. That is a really wonderful tool. And what I'd like to do is in the Q&A, I'd like her to elaborate more on, what things you could get from Common Sense Media. Practical tips. Is it just for families? Is it for professionals? What sort of handouts they can be for physicians, etc.? What sort of ratings and gradings and guidance there is? But that's a very good tool that's out there. And in addition, there's many other either policy statements or articles that we've included in this bibliography that's there. The reason I wanted to, go quickly through this is to read. I know this is a very hot topic. Madam has told me also that there's a great need for screen media guidance for pediatricians and for families. And I really wanted, given how amazing y'all were the last time with my ADHD talk, I think that there's going to be robust discussion, particularly since we have an expert whose career sort of research has been in the field, like Dr. Zaituna. She's part of an amazing team at the University of Michigan with Dr. Jenny Radeski, who's really one of the pioneers in screen media use and children, and is well quoted and well, acknowledged as a leader. And she's one of Dr. Zaituna's mentors. So we're happy to take questions, maybe even understand some of the contexts we're missing out in terms of the Indian context of what you all are seeing on the ground. Looks like it's pretty similar, at least from the literature, similar amount of time spent, similar amount of risk factors, and ultimately on the guidance, pretty similar themes from the AAP and the IAP. But I'm wondering how in the trenches that you all are at, what things you all are encountering and what resources you all are using. So Dr. Samir, Dr. Sandeep, Madam, we're happy to sort of open this up. But I deliberately wanted to make this more of a discussion, and you all always can have the slide deck, and we'll be back for the older kids. So if you can avoid talking about school age and adolescents today and focus more on the younger kids, we'll get that done. And the next time we'll have a robust discussion around the older kids.
Thank you, Neil and Julie. That was an excellent presentation, and I'm sure there'll be a lot of questions. Before that, I had a few comments to make. Neil talked about Common Sense Media. I've been using that regularly, and it is excellent. I use it a lot in my lectures. I also use it to get the printouts to give my patients, and I would love to have you elaborate more on it for those who are not aware of what Common Sense Media is. One question before Sandeep starts taking all the chats. I do not know whether this is a generalization or an anecdote. So I would like both Neil and Julie to answer this. A lot of pediatricians are handling patients in the Pimpri-Chinchwad area in Pune. Now, this is like Bay Area or Bangalore. This is a hub of technology. There are a lot of software companies, and a lot of couples, a lot of parents are both techies or working in the software companies. And some of the pediatricians have shared this with me, that both the parents who are very involved as techies or software things themselves seem to have some autistic traits or communication problems, because it's said that many autistic people also choose being a techie nerd because that is something which suits their personality and they have the brilliance. But what they have noticed is that these techie parents are not able to communicate with the children as much as the non-techie parents. And very often, some of them have come with language development delay. So is it just an anecdote or a personal finding of the pediatricians? Or would you both as development experts, could you make some comments on this? After that, Sandeep, you can start taking the questions in the chat.
Okay.
I'll let Julie talk a little bit more about common sense media in a minute. I'll just opine a little bit on that. I have not seen literature specifically that talks about the developmental status or disability of a parent on the spectrum and how they handle parenting vis-a-vis either media or something else. One of the things I will say is there has been an evolution of guidance. So it's possible when these parents were children themselves, they were not good guidance to their own parents about handling screen media. Their landscape of screen media has been very different. Forget about the pandemic, even in general, the evolution of handheld devices, the evolution of subscription. So the role modeling they may have received may not have been ideal compared to what we want today. So it's a generational thing. A second thing, of course, is there's this tendency, and again, it's anecdotal, where when you're in a field, you are you believe that interacting with that field and supporting that field is important in general. And some of us get very myopic around the downsides of our field, right? So for example, we all know that doctors make the worst patients for themselves and for their families because we are tending to overemphasize certain aspects and we're not taking the bigger picture. And it's possible that techies love tech, but may not be appreciative of some of the downsides of tech when it comes to child development, etc. So there's a generational thing. There's that immersive, content expert thing that makes us, to be a true agnostic of your own field takes a lot of skill because you believe it, you live it. And so to reject some of its premises is a little challenging for the best of us. And for people perhaps on the spectrum, it's even more challenging because of their rigidity of their nature, right? They're black and white about certain things. So tech cannot be both good and bad at the same time, right? It's good or it's bad, but more than likely they believe it's good. That's why they work in it. So there are subtle things regarding the communication. The type of communication that autistic adults have, particularly if you're functional enough to be working in tech, right? That means cognitively and language-wise, you're not intellectually or significantly communicatively disabled. They may struggle with the subtleties of social communication, pragmatic conversation, but in terms of child rearing, I don't know if there's any data out there that says that translates to a poorer interaction in terms of that. Now, remember, if they are autistic, there's a small chance that their child may have similar types of traits. So it's a bi-directional thing. Maybe the child also has emotional regulation issues, and therefore using something like media calms them down, which comes back to Julie's point of please don't use tech to calm people down, because developing skills, remember, once they go to school, it's not like the teacher is going to be happy to give them a tablet. They're going to go sit there and do your work. And if the child throws a tantrum, they're out the door, right? So learning little skills is important, but it's a very good point. I think it's also a very sensitive point because it's possible many techie parents don't know that they're on the autism spectrum. Nobody's ever done an eval on them. No, but I think it's a great point, madam. If somebody wants to consider this, particularly since you seem to have a hot hub there near Pune and another hub maybe in Bangalore, maybe, doing a survey of parents with who are in tech and look at their perspective. Julie can really give guidance because she's done a lot of research in this. What's a way to non-judgmentally survey parents about their own perspectives of screen media and just use of things? Because that would be a stepping stone without even opining on the autism part, just opine on their handling and see whether, you do a broad survey, but those who say, in what industry do you work? You do a subset analysis and go if it's healthcare versus tech versus service industry versus hospitality, etc. But it's an excellent point. If there are any residents or fellows or junior faculty who are willing to take that up, that would be an amazing study.
That's nice. Neil and Julie will connect with you for AACCI multi-centric research. And then
Yes.
just comment before I hand over to Sandeep. Techies are very resistant to not giving the screen to their kids. And in my practice, when I was to tell them, they said, "Man, this is the digital world. And the sooner my child gets an expert in the digital world, the better he will do in life. So they're quite happy introducing their child very early to devices. And they're very proud that the child can use this. So instead of keeping the children away from the screen, they in fact feel that it is good parenting to make the child very early a device expert or a techie expert. And we have to spend a lot of time trying to explain to them that they will learn everything in their own time and don't rush them with devices because it is causing some harmful effects. So all these things, I think Neel and Julie, we should discuss this out. And our core group, that is Sandeep, Samir and Prashant, will have a Zoom meeting. And I think it's worth doing these surveys. But that's for another time. So now, Sandeep, please take over and give the chat box questions over them.
Thank you.
And while Sandeep is doing that, Julie, if you want to comment on the benefit of common sense media for pediatricians,
Sure.
Madam clearly has been doing it for a while,
Yeah.
but for those who don't know, what is the easiest way to use common sense media?
Sure. And so Common Sense Media is a nonprofit that's been around since about 2003 that has different recommendations based upon media and then also education, and has different branches in terms of the research program that informs a lot of its recommendations, and then also on digital literacy, on maintaining privacy in a digital platform. And so has a lot of handouts and resources that are helpful both for parents, for educators, and then for us as providers too, to be able to share, to be able to kind of be communicating with shared language with evidence-based practices regarding digital media use.
And so as you can see, there's many areas that you can look at in Common Sense Media. There's a section on parent tips and FAQs by each platform. So if you think that somebody is doing, now one of the things clearly is I think that there are many more sort of platforms and games and things in India that probably aren't as familiar. So that would be a really good thing, like PUBG and other things. How up to date is Common Sense Media in a global scale versus a US scale? But there's still plenty of things in here that, there's a lot going on in India as well. But yeah, this would be a great thing to familiarize yourself, even direct parents to do it. So Madam's, concern about the, what do the techies say about it? Well, are the techies aware of some of the guidelines and stuff? They know the positive bringing things, but rather than saying that's bad, maybe going to what Julie had said is talk about displacement and how that's not great. So yeah, they should be experts. We want them to get a heads up in life, but not at the expense of their sleep, or not at the expense of their fine motor skills, or not at the expense of their social skills. And we want them to know about tech, but not by themselves because they're still too young, and talk about the whole 2D world, 3D world, and the parent being the facilitator. So rather than going no screen media, I think they would be okay with screen media with some caveats. Would you say that's right, Julie?
I would completely agree, and really emphasize that point of the parent being the teacher and the co-viewer of the content, and really engaging with the child in that back and forth.
Okay, questions from the chat. Sandeep or Samir, do you want to share?
The one observation I would like to share on the context of techies, I find that nowadays, since COVID especially, techies are becoming slightly more aware because they are connected with the media, and even the content that the media continuously is bad for children is reaching them. What I find it very interesting is those who are illiterate or very poorly learned patients from, say, working class background who come to us, many times it happens that mother or father, they have just the mobile first time are using, and they don't know many things of it, and they find it very interesting. Their 1 year, 1.5 year old can navigate those, can find the YouTube icon, can open the video, and that becomes a sense of pride for them that my child at 1.5 years can do something which an adult like me cannot do. And co-viewing then becomes out of question because they can't filter the content itself, they don't understand. So here I find it for teaching them that this is not good for your child becomes slightly tricky. Techies, because they go and then search on Google, they get the data, they understand that something which the doctor is saying is connecting to my child. But for them, it becomes very tricky for me to counsel.
Very good point, Sandeep.
There is a question in the chat box about virtual autism, because now after COVID, many times this is a term which is commonly told and parents also feel it is okay. Virtual autism is okay than the child being really being autistic. Is this now, what do you think about it as a valid term, any diagnostic criteria, and how and when to evaluate such a children who may or may not have this autism? So speech delay children coming, and parents sometimes they themselves tell कि TV की वजह से या screen की वजह से हो रहा है. So what do you think, sir?
So I'll chime in, and then of course Julie will chime in. So there's no DSM criterion around the term virtual autism, right? And it's actually a chicken and egg thing, because I don't want people to dismiss the possibility that somebody who is obsessed with screen media cannot have autism, right? It's possible that because of their spectrum disorder, they're taking comfort in repetitive engagement that is more predictable than having to deal with social. It's also probably they have dysregulated behaviors and the parent offers them the screen to get them to calm down. But it is not, there's no construct which says that a typically developing child, as a function of spending excessive time on media, then develops autistic features per se. Because the problem is that it's autism is a genetically predetermined disorder that shows its face even in infancy, if you're watching carefully and you know what you're doing. And it's not likely that you develop and then you regress because of screen. If you're regressing, then you certainly have other things possibly going on. I would be concerned about seizure disorders, metabolic disorders, other types of regressive conditions. But I would say, yes, it is reasonable to seek professional guidance, but maybe rather than rushing them into an autism evaluation, just say, as Julia is saying, get a sense of what's going on with family patterns, behaviors, right? So a good question would be, if they're not with the screen and they're around their cousins or they're in a play group, what do they do, right? Because children who are typically developing, they pivot between different skill sets depending on their environments. It's not that if they're got no screen and 3 kids surrounding them, that they will go running to seek a screen, right? It'd be like, if you made it available, they might, but if it's not an option, well, they'll make the best they can do from the environment they have, right? What is happening in non-screen environments? And language can plateau, and Julie pointed out, and I pointed out, that excess screen media time can cause, delays in language development. But it doesn't take away your nonverbal skills. I've never known screen media time to take away your ability to point or to say, come on, or to shake your head, right? That's not likely. So if the child has nonverbal communication deficits, or, behaviors that are repetitive beyond screen media, or, inability to play appropriately, like excessive fixation, so then, yeah, you would rush the formal evaluation, but not just because they're not talking much and they're fixated on screens. That alone is not enough. Julie, your thoughts on this?
No, I agree, Dr. Soares. And just to kind of echo that really those DSM-5 criteria, that in considering an autism diagnosis, that's really kind of what I would say is key. I will say that we have seen for other behavior concerns, especially in the school age group of children, that separating from screens and leading to behavioral dysregulation as a result of that is something that has come up quite often recently in the past few months in a lot of patients that we've been seeing. And that to the point that some parents have just kind of said that, at this point we are separating or having very strict controls around screens, specifically with independent tablet or phone usage for the child. And just to speak a little bit more about really maintaining that curiosity about what media use looks like for a family, whether that's television, YouTube, online gaming, and really having that open-ended question about is separating from media. Is that a problem for in your household or your child, or do you wish that your child had less use? Like asking those open-ended questions, if possible, can give a lot of information about what's going on with media use too.
Julie, for the busy pediatrician, are there some ready-made printed forms that will help for the types of questions they can ask, or maybe something that the family can fill out ahead of time or in the waiting room, because it's possible that some of the pediatricians may not either remember some of the key questions to ask or might not have time. So I'm wondering, is there a self-questionnaire that they can quickly review, maybe even score to get an idea which sort of patient needs more counseling or needs less counseling on the matter?
I know that we have a dot phrase that we're piloting in the electronic medical record and Epic that we're using to ask those questions, and they're really just like 2 questions. But I can share those in the email chat if that would be helpful, just to see
Yes.
if that can be implemented into visits.
That'd
Yeah,
be nice.
because even if it's 1 or 2 questions that the pediatrician can ask that can lead to more discussion, is so much more helpful than expecting that they will remember to ask specific questions. So maybe as they're asking about different questions, those 2 just get slid in a certain point in the visit, or it can be something that the families put as part of their initial visit also.
That's a very good idea, Neil, because when we are taking off tobacco prevention, we have this Ask 5, where these are 5 questions if the pediatrician integrates into an adolescent questionnaire or a parent history taking. They tell us a lot about how to go about and counsel the parents and the adolescent about tobacco. So I think it's a good idea to have. That's another thing I just wanted to share with Neil and Julie, that we have a lot of WhatsApp share of grandparents and parents of their kiddie photos, their kiddie videos. And some of the videos which the parents and others found interesting and which I found horrifying were that they had videos of their child as young as 6 months or a toddler or a 9-month-old sitting with a screen in his hand. And when it is taken away, the child going into severe tantrums, literally, falling back and hitting out. And then the child gets the screen back again. The child calms down, starts seeing, and the parent again takes it out, and the child has a similar manifestation. And this was taken as something very funny or something just to share, when it was such a horrifying scene of screen addiction at this very young age, and like withdrawal symptoms and tantrums when the screen is taken away. So have you had something like this in US?
Well, I can't speak for that specifically, but when I was a resident, we had an equally horrifying situation where one of my co-residents invited us over to his house, and his child was about 3 years old, and he was a little hyper. And the father would give him 2 cans of Coke and watch the kid run around and laugh. And then when he slowed down, give him 2 more cans of Coke. And he did this most of the evening. I never visited that family again. It was outrageous how people can manipulate children for entertainment, not realizing the harm they're doing. So I would assume it's the same thing, right? Trigger a tantrum from a child because it's apparently amusing to viewers, give it back, almost like turning a switch on and off. But the harm that they cause to children is unacceptable, right? And so I think, one of the things is, if parents or grandparents was to share that, I would be I don't think that's amusing. And I would give some feedback on why I thought. And I said, it's unfair. It would be unfair in any context, right? You don't just rip something from a child. Forget the screen, even if they had their soft toy, right? I would argue, do you think it would be funny if they were sitting eating their food and you pull their spoon away? Well, don't do things to children that don't respect them. So yeah, I would give feedback on that, because I can see, in the digital world, people want instant entertainment and they think this is funny, but it's absolutely not funny to me or Julie at all.
I
One
have
question I
given
would-
feedback to certain parents whom I knew, and some of it took it very positively and changed, and some of them, of course, didn't like it. But majority of these videos come anonymous. So they're just forward. So we don't know who has sent it and whose it is. So it's very difficult to reach out to them. Yes, Sandeep, go ahead.
My question is, now with the advent of augmented reality and virtual reality, it can't be one distraction. The whole world itself would be that which the child is viewing. So is there a hierarchy of the devices which we can give the child? So if the child is a toddler is spending 1 hour with the screen, is TV screen, 55 big TV screen better than a computer, or better than a tablet, or better than a mobile, or all devices the same?
Interesting. Neil, please unmute.
Julie, go ahead, like about
I can
the AR.
Sure, I can kind of weigh in just about like even looking at the context of how the device is being consumed. If you think about a TV, that more likely than not, it's more readily available to being able to be co-viewed just because of the size of the TV, that it's more able for the child to be co-viewing that quite easily with the parent. I would argue too that because of the size and portability of a tablet and then a phone, that may represent itself to the child thinking more so that, oh, this is my own tablet or my own phone. And so while that can also be co-viewed with a parent, that is just, it lends itself less easily to that than television, but really the content. So making sure that high quality content is what's appropriate, that for the early viewing experiences, so that thinking it's like a Sesame Street that's very structured, has very key breaks where it's having this time for interaction to happen with the parent, with different things that are happening in the show, and that it's a very finite time. I can see some of the questions in the chat about the nursery rhymes, just in my own viewing of content that's on YouTube that young children are finding, that oftentimes for like the Coco Melon or the nursery rhymes, that these are like an hour and a half or 2 hours, where it's just this constant stream of nursery rhymes that are being fed to this child on YouTube. It doesn't have any end in sight. That also, I think, is also a danger, and why to make sure that co-viewing is really happening intentionally with parents.
A
Regarding
lot of people put these nursery rhymes to get their child to eat, because it is too much trouble to make the child do healthy eating by interacting with the child, and they rather keep this like a nanny, keep the child with the nursery rhyme and then give stuff so he can keep eating on his own.
And that's why the IEP and AEP both say that it should not be used for, the typical development thing. Regarding the virtual reality and augmented, I think that is going to be very important going forward, because little by little, the products are going to make their way onto the shelves. Right now, they're still very expensive for most people, other than a very select group of people. And the programmers have not unveiled a huge number of sort of apps and environments yet. So it is being used mostly by adult gamers. The other thing is they haven't yet, thank goodness, developed wearable headsets and all for young children. The day that happens is going to be a huge problem, because now the question is, what is that going to do to young children's developing brains to be immersed? Because some immersion environments can be very frightening, because they bring a perspective that is, you have to have an abstract enough concept to be able to get into an immersive environment. And young children are very concrete. You don't want them to believe that they're actually standing next to big man-eating dinosaurs, right? It could generate panic attacks and stuff. You have to know that an environment is virtual and not real, in order to escape from it and feel safe if you felt threatened. But if you don't know the difference, it could engender harm. And so I think there's going to be lots of good research coming out of this. But I think, at least in the US very recently, there are steps by the government to really crack down and say there should be more regulation of some of these, artificial intelligence and other environments. In fact, in India also, I believe, and we'll talk about this in the next session, the Rajya Sabha has strongly suggested that there be clampdowns on a lot of media, TikTok and other things, because the parents have finally had enough. They believe that screen addiction is a problem and a lot of issues are there. So I believe there are going to be laws going through the Indian legislature as well to either limit, restrict, or even outright ban certain things that they view are harmful to families.
You're
So
right. There
stay
are a lot
tuned.
of TV discussions and panel discussions on this important issue. And I want you to park one thing for the next session when we are talking of adolescents, because recently I saw in the CNN others a case which is going on of virtual gang rape on a girl. And this is all virtual chat games. And it was very interesting and very difficult. So I will just park it out and I'll tell you what it is. And I'll just give you back. The another thing I wanted to discuss was that, 1 minute, I just lost my link. So one was, of course, discussing this for the next. And I saw the whole Senate discussion where Mark Zuber and all the AI intelligence and almost 8 of the company CEOs had to undergo a very rigorous answering by 20 senators of the US and what they were doing to make it more safe. And all of them were on the back foot. I mean, they kept saying, no, we have safety devices, we have monitoring of the contents, we have this, that, but they were not even spending 2.5% of their profits on the safety devices versus what they were spending on making the games and the social media. So I think the US senators also are coming around very heavily on the AI and the related matters.
Yeah, and we'll certainly have a robust discussion next time when we talk about the older children, because they are more likely to get into some of those content. Sandeep, is there anything else before we wrap up?
Just one question before we end. We were discussing about content where we are not involved, but the apps are making. So shouldn't AAP or IAP or such platforms get into content designing? Is it worth it? We should. What is your opinions? Because we have to give them some options. And can we really design content which may be better, helpful, that 1 hour which they are spending on screen, make it better than the content which is being marketed, which is ultimately for profit. And it is very difficult to regulate any for-profit company. Even if Facebook does not do it, somebody else will take their place. So
this is perfect for Julie, this question. Yeah, about how do developmental specialists get involved?
I think that's a really interesting question. And yeah, I think that having a role of experts in the field informing app development and making sure that it's very intentional, it's very structured, it's very regulated, I think that's a really important conversation to have both in the US and in India about kind of integrating, how do we integrate ourselves into these apps to be supportive of families and patients.
Sandeep, the only risk there is physicians aren't well trained in business in general, and they might make suggestions to the leadership that are not viewed as profitable, right? Limiting time, making sure. So really, we need to be better at understanding the business angles so that of the 5 recommendations we can make, we go gently, because better to at least get a small win with the company and make a change rather than go for something they're going to outright reject because they don't see it in their profit, right? So good business training and understanding where these people come from. So, if there are physicians who understand that, they should be the champions rather than the physician who's going, but the guideline says, right? Because the company doesn't care about the guideline unless it's a law. They care more about laws than guidelines, right? Because the guidelines have no punishment, but laws might. So I think it's great to have, specialists and pediatricians who are experts in children in general, forget about developmental specialists, just children in general and families, be involved. And the best companies probably already engage them, but know that everything we want won't happen because money makes the world go round, right? And they care about that. They're not going to want to do a perfect app that doesn't make them profit.
Really, till then, what I can say is AAP or IAP should take a lead and make app certifications where they, like Common Sense Media, they can certify certain tools. And if the app adheres to certain guidelines, we can give them those certificates. And this certificate, AAP or IAP, will have certain value with parents, because ultimately they will also be promoted by the local pediatricians, which the children is shown. So that may be one short way out of it. Till then.
Yeah, that's a good point.
Thank you very much to all the viewers. We had a robust discussion.
Just 1 minute.
Yes, ma'am.
Just ask Dr. Gredanis for his comments. Don, would you like to add something to whatever was going on?
Well, I want to thank our speakers for their excellent discussion. I can just add the fact that I was just reflecting on my career and life. When I was a little boy, there was screaming about too much TV. Stop watching TV. It's going to hurt your kids. You'll never get anywhere. And then watching this develop into what it is now, I've always told my parents and ones that I worked with and kids, shut the TV off, shut the internet off, sit down and read to your children, interact with them, play baseball, play basketball, play ping pong, play soccer, just interact with them and show your love and get them off whatever the screen is. I like the IAP guidelines. I think they're very well thought out and beautifully written. AAP is coming along nicely, but parents are so busy trying to put food on the table, trying to keep a job, trying to live life. And so it's difficult to say to them, stop using the screens as a babysitter. So what I've done to them is tell them some of the greatest moments of my life as a father and as a grandpa, it's the Dutch side, we call it opa, is to sit down and put everything off and just sit down and read. There are so many beautiful child books that are out there that you can find. And some of the greatest moments of my life, I call them bubbles in my life, is sit down with my kids, now adults, and now the grandkids, and sit down and read some of these beautiful books and interact with them and see how their mind thinks. And you can teach them they can help them to read, help them interact. Just some amazing books. I just did one yesterday, a beautiful book called The Pigeon Needs a Bath. And it talks about a pigeon from an award-winning writer who used to do on Sesame Street, where the pigeon says, I don't need a bath. And then, yes, you need a bath. And then once after the whole story, and you can interact with your grandchild, once you get him in the bath, the pigeon doesn't want to leave. And then you can interact in so many ways. Well, why doesn't he want to leave? And you go on and on and on, and you're away from the screen time, and you're just interacting, you, the grandparent or parent, with the child. And so the big thing is shut the screens off. But we have a society that is screen addicted and out of control addicted. And what do? Society itself is addicted to screens. What can we do except do what our speakers have talked about? Study it, try to give parents some information, but they're so busy. And they use the screens as a way to be a babysitter. And we have to try to stop that interaction and prevent it if we can, and kind of go from there. I want to thank the speakers. Very nice discussion. We as in the field of pediatrics have to continue to try to give the parents, grandparents, kids interaction, try to limit that. And I applaud the research. We certainly need that. I did a book with Dr. Artemis Zaituna on teenage interdiction, which came out about 10 years ago. And Artemis is the Swati Bhav of Athens, Greece. And so I think maybe we need to do a second edition on that, because it's just gotten worse. What we can really do about this in a society that's so busy trying to keep itself going, trying to feed its family, and use the screen as a babysitter. And then you go to school, and of course there's screens everywhere. So I applaud the research you're doing, and we certainly need more guidance in this area. So thank you for your discussion. It's a problem that simply is not going to go away. And it's one of these problems we just have to live with and try to minimize the damage that it does to our children and to our society in general. Thank you.
Thanks. Thank you for your insights. Sandeep, shall we wind up now?
Yes, sir. So I would like to thank all the esteemed guest audience who were there for today's webinar. This is an ongoing series, and this was the second part of the ongoing series. We will have the next session in the coming month. I would like to thank both our speakers, Dr. Neelkamal Soares and Dr. Julie Zaituna. The talk was, so even though concise, it was comprehensive, and it opened the eyes, having different perspective to a topic which is close to all pediatricians' heart. But we yet find it confusing sometimes how to deal with it. So there were many practical tips along with the theoretical information, and we are very grateful for it. And looking forward to the second part, where we'll be discussing the next, when the problem really comes to roost with in the teenage years, when these problems really show what the deadlier and adverse effects can be in a child who has been addicted to the screen from the childhood. So next time we'll have the other next part of it. So thank you, both the speakers. Thank you to AACCI for organizing this series. Thank you to Dr. Gredenus for his comments and expert opinions. And again, I welcome you all to take part in this series. This video will be on the YouTube platform also, and you can share your questions there in the chat box, which we can take off on the coming sessions. Thank you very much.
For information of
Thank you.
Julie, last time's video to YouTube of Neel got 167 views. So just because we had only 12 participants on this, Julie, don't feel that your lecture has gone waste. Once it goes on the YouTube in the coming days, you will get definitely a lot of views because this is a very important topic. And if you keep clicking the YouTube link, you'll keep seeing how many views you are getting. So that will make you realize how many people are enjoying watching this program.
Thank you very much.
Thank you all. See you all in June.
Yeah.
Okay.
Have a great
Our next
weekend.
program is going to be by Dr. Gray Danis on youth suicides. That will also be a very important topic.
Yes. So see you then. Thank you very much for your interesting participation. Thank you.
Bye.
Thank you.
Thank you. Have a good weekend.